Did you miss out a best practice, or did you go there and just didn't have the opportunity to speak to all the variety of providers that are there at the conference itself? Well, don't worry. I spent the day going around speaking to so many different providers, in fact, over 20 of them, to figure out what they're doing to help you in general practice and in terms of figuring out what's new from their perspective to help understand everything that we talk about here on the channel. So let's get cracking as we talk to those different providers. It's a good episode. It's an amazing piece of content. You're going to love it. Let's get cracking, shall we? Hey GP learners, so I'm here already at the Quantamloop stand. As you walk into the best practice, massive stand, and I know this is day 2 kicking off. I know you said yesterday seemed a bit busy, but today is still looking pretty hectic and stuff. How's it going?
Very busy for sure. Good morning. Yeah, it's 9:15, and we're already having so many people. Everyone is at the stand is talking to a customer, potential surgery. So yeah, very excited to be busy first day and second day.
Yeah, and for those that don't know, just tell us a brief thing about what Quantamloop AI does.
Yeah, so we have our main product, which is Emma, which is our virtual receptionist. So helping surgeries around England manage their calls. Every time a patient calls in, they're going to have Emma answering the phone and helping them with a request, no waiting time, and best service for them.
Definitely. And I know one of the things we're going to have a quick look at is your new tool, which is the outbound call support by Emma itself, particularly focused on flu campaigns. So if you guys want to trial it, definitely go have a look at the Quantamloop AI website to give it a go, and the team I know are more than happy to speak to you about how this works. Obviously that's the outbound calls. You guys do a huge amount of inbound calls as well.
Definitely.
Summary on that?
Yeah, so that's how we started. Inbound calls, whenever a patient calls, Emma picks out instantly regardless of how many calls the surgery gets, and then she's going to ask the patients who are they calling, and then based on that decide on the next step. So she'll start perhaps with redirecting patients to pharmacy first or other community services, anything that could help them quicker. Also, if it's an emergency, they're going to tell them to call 999 and ensure they get immediate care if it's appropriate. And then if it's a request that the surgery has to deal with, she's going to decide if it's an admin or a medical request. And based on that, she's going to ask the appropriate questions. So if it's an admin, test results, feed note, stuff like that, she's going to try to either redirect again. So for example, NHS app, we know that we have that 10% increase in usage, so helping with that, or filling in a request form that comes to the surgery. And then on the medical side as well, asking questions. We either have standard questions that are being asked, for example, AccurxUK online consultation tool, those 5 questions, or we've introduced last month branching logic. So for the 10, we started with 10, but we're going to increase that. For the 10 conditions that we worked on, she's going to ask specific questions. So if I say I have an eye pain, she's going to ask me specific questions. Do I have blurred vision? Any chemicals that went into my eye? Just to get more richer information to help with triage. And then, yeah, that's sent to your surgery for the team to triage and decide on next steps.
So GP learners, I'm here with Laura from Blinx, and we're talking about various different things. What's coming next then from Blinx?
So the next step is EPS, electronic prescribing, so getting that set up. So that is in sort of final testing phases now. As I'm sure you can all imagine, there's a lot of things that need to
bureaucracy.
Yeah, a lot of red tape involved in getting EPS sign off. So that is coming imminently. We're just kind of in the final testing phases for that. The next steps really are quick consultation, so the ability to have add a consultation into a global record that anybody in the PCN or your neighbourhood, when we get there, can add that in, and it all kind of would then be synced in so that it makes sense, so that it kind of drops in the right time frame and everybody has access to the bits of the patient's records that they actually need. And the ability to manage workflow across that greater than one practice footprint. So whether that's PCN, whether that's some kind of shared clinic, or whether it is a neighbourhood, that ability to kind of put things in, but also limit so that, you know, if you've got a PCN and there's a big size disparity in the practices, you can say, right, okay, this practice can put in 80%, this practice can put in 40%, because that's the things, those percents don't add up to 100, but you know what I mean. So they can actually kind of get that equity of access across the PCN, across the neighbourhood, so that it's manageable for everybody.
Awesome, particularly that neighbourhood aspect and stuff. So where can people find out more?
So if they go onto the Blinx website, I'm sure you'll be able to put a link in. If you go onto the Blinks website, you can find out anything that you want to know about us. You can also book from the website demos with the admin side, demos with the clinical side, so that you can look at kind of everything and how it works across a practice, across a PCN, across a neighbourhood.
Awesome, thank you. So tell me about GPTriage. I know you've got some big news, and particularly what's been happening this year.
Absolutely. So you obviously know we work in partnership with GPTriage. So some major news update is that actually the AI brain that we license exclusively in the UK has actually received 2B accreditation in Europe from the company that originally made it. So although we can't say GPTriage is a 2B device, we can say that the AI module that we use has 2B certification in Europe, which is phenomenal because that's obviously going to carry over into the UK till 2030, and we're going to use that time to make sure that we've achieved the same thing in the UK as well. So it's transferable in the interim. So I'm not sure anybody else can really make that claim.
Okay. And I guess just for those that don't understand what that means, so this is the classification in terms of medical device. It's the thing that everyone's talking about when it comes to clinical governance of tech, particularly tech with AI behind it. And most places are classified as class 1, which is summarization tech, that kind of stuff. Class 2B is much more for the medical use. Definitely a milestone for any company that's trying to provide services to patients and stuff. And last year, you were obviously GP specialist. Now you're Vallour officially, and finally, yeah? Tell us more about that.
Yeah, so this was really quite complicated. So obviously we started off as a partner support service, and partners are only relevant in primary care. So we called ourselves GP specialists. There's a bit of a nuance to that. So I used to be a GP specialist, and that was the inspiration for the company. We started doing quite a bit of work with ICBs on sort of pathway redesign, headache flows in different ICBs, almost secondary care focused. So we didn't feel it was representative to call ourselves GP specialists, given we're now working with private sector, we're working with secondary care, with ICBs. And given we've now started to get involved in technology as well, we thought it was the appropriate time to do a rebrand, and hopefully it would encompass all of our service offerings.
So what's next for Vallour?
You always ask this, and nobody ever knows until you ask, right? That's the privilege of being you, isn't it? So we've already completed one MVP, which is a CKD decision aid. We haven't talked about it because we're waiting to go through device registration before we can talk. I guess that's the benefit of knowing Hussein, right? He gets all the gossip first. We have just secured a second round of funding to create a lipid management software. And I'll tell you now, there's about another 12 in the pipeline. So essentially what will happen is the aim is to have a live piece of software that will take comorbidity and patient data into account when the patient's being consulted. And the reason it has to be a medical device, it will tell you what to do.
Awesome. So definitely check them out. If you haven't seen them at Best Practice this year, I know for a fact you guys are going to be back next year. So definitely check them out then. If not, check out the websites, Vallour or GPTriage. Great companies. Definitely worth looking at. I'm here with Max from Team Exon Surgery Assist and stuff, and telling us about what's new from your side.
Yeah, very, very exciting launch this year. Very exciting Best Practice show. We have announced that we've built out an intelligent care navigation system, so that combines our suite of products and features within those. So I presented yesterday the depth of features and functionality within each product that we have, but then also the integration between those to ensure that we can deliver equitable access to primary care.
So when you talk care navigation, explain what that means to everybody else, because that has various different terms in different places and stuff.
Yeah, no, it's a very good point. So for me, care navigation, we're all trying to adapt and build out these care navigation processes. For us at x-onhealth, we're really focused on equitable access to care, which means that whichever way a patient needs to require access to GP services, I say GP services, let's broaden that to primary care and community services, they're getting the same level of care, but also the same experience. So an example might be that a patient is hard of hearing and therefore might tend to use the website rather than calling. So how does their care pathway look when they approach the website? And that's the reason we developed Surgery Assist. Another example is that if a patient was visually impaired, and this doesn't have to be permanently disabled, it may be a temporary loss of sight or vision, they may need to use the phone. So it's important that those patients that then call into the surgery, what is the care navigation pathway that they go through, and how do we ensure that's equitable and they get the same access to the care that they would in otherwise means?
Awesome. So here with Aaron from GP Automate. Tell me what's happening new at Best Practice for you this year.
So we're releasing a new product for lab reporting. We've built it from the ground up. We've built it from scratch. We want to automate your lab reports and automate abnormal lab reports. So we're already registered as a medical device, but we're taking it to the next level, allowing you to customize your ranges, customize your outcomes, and really automate your practice your way. So behind is our little slogan, so you really can automate your practice your way. Got a Tony's Chocolate Only, and you can book a demo straight, so for anyone who comes and joins us. Please make sure that you look out for us. Join us via the website and grab a demo, and so you can see what we can do to take away some work.
Definitely a great giveaway. I love the Tony's Chocolate Only and stuff. So GP listeners, I'm here with Osman from AccurxUK. How are we doing there?
All good, thank you. Yourself?
Yeah, ticking on. How are you finding today?
Today it's busy, it's getting busier.
That's good to hear. So tell us what's new at AccurxUK.
So loads of stuff new. I think there's everything around triage, there's scribing, there's a potential navigator coming down the line to help with the GP front door. So there's lots going on at the moment.
Awesome. Tell me a little bit more about this navigator, because I've not even heard of that yet.
So navigator is where you can actually have your patients say, actually, what's my problem, and they can be potentially directed to other avenues rather than having to come through to practice to book an appointment.
Awesome. And how
streamed elsewhere.
And how quickly do you think practice will start to see that come through from AccurxUK?
So it should be coming through in a few weeks to practices who are already using patient triage.
Hey GPLers, so back at Best Practice here with the team from Tandem. How are you finding it?
Yeah, awesome. Super invigorating. Loads of interest. It's been really positive.
Cool. So tell us about what's new for Tandem this year at Best Practice.
Yeah, so quite a lot of stuff. One thing that's been really exciting is being able to show all of the GPs that have come to have a look, all of the new template suites that we built out to increase accessibility within the practice. So now, beyond just like our GP templates, our fully clinical team have invested loads of time as industry experts in building out templates for, say, physiotherapists that are working in the practice, for pharmacists doing medication reviews, to make sure that nobody's left behind and everyone gets the maximum use out of Scribe. And of course, all of those templates, like all of our other ones, are fully integrated with Emerson System 1.
Awesome. And where do you see things going, I guess, in the next few months as well?
Yeah, great question. So over the next few months, we're going to invest a lot of time into increasing personalization and memory features, as well as making more bespoke templates through our template building features for primary care GPs, while making sure that we don't sacrifice our industry-leading standards in note quality, and making things a little bit more flexible for everyone while keeping our transfer safe and secure.
Hey GPLers, so here at Best Practice, here with Matt from Health Tech One. How are we doing there?
Yeah, we're really good, thank you so much. We've had a really busy day. Today is day 2 of Best Practice. We had so many people come through and speak to us yesterday, and today we're really excited for the energy that it's going to bring.
And what's new with Health Tech One at the moment?
That's a very good question. So we are now serving 24% of England's GP practices with our automated registrations and lab reports technologies. Patients love it, staff love it, we're saving so much time for them. And today at Best Practice we're showcasing something new. It's called Bookable, and we are slowly rolling it out across the country, and we'll be excited to share a bit more on our website and on LinkedIn over the coming weeks. So it's exciting to get some feedback from GP practices here live at Best Practice.
And what do you think is going to be the key thing that helps practices with Bookable if they start using it from tomorrow?
Yes, well, I think we have made the onboarding really simple and straightforward so they can get started. And as with all of our products, we make sure that it's start and stop when you want, there's no long-term contracts. And for those practices already using our products, it's really easy for them to add on any more and get set up straight away.
So with Bookable then, I know that that's kind of like your sneak peek thing that we've just had. The best place, I guess, for the people to find out more about it is going to be the website?
Absolutely, yeah. People can find out more about Bookable on our website, and we'll be sharing more information on LinkedIn. And of course, if there are events like Best Practice or any more in the future, we'll be sharing more about it then too.
Definitely, so check them out. So HBLers, I'm here with Best Practice regular Dustin at Primary Care IT. How are we doing there?
Hi, I'm doing really well, thanks, Candy. Yeah, you?
Yeah, ticking on. It's been a busy day. Interesting day 2 of Best Practice. How are you finding it?
It's been really good fun. It's lovely to see people. It's lovely to talk to all of our customers. Nice to meet some new potential customers, and also good to see like everybody else, like you you and other people like you.
Great network experience, that's for sure. That's the main reason I come here, to be honest. But tell us, what's new with primary care IT this year?
New with primary care IT this year, we are now live with 6 Medicus practices, which is fantastic. So I went and did a surgery a couple of weeks ago with Amar Ahmed in Wilmslow. It was a dream. Loved working with those guys. We've been expanding our System 1 tool set, so should be using that again.
Fingers crossed.
Bringing out loads of new cool tools. So analytics this year has had a really big upgrade. We've now got externalized. We can do Q risk without any need to do that in the clinical system. Do the same with Q frailty, and we can segment those patients by those people who've never had their Q risk assessed, those patients who've never actually been assessed for frailty, and then be able to look at those patients who need to come in so that we can assess them and get them treated properly. So it's good stuff.
So you mentioned frailty. I know a lot of places are looking at frailty as the big thing to hit off, particularly from a neighbourhood perspective. You know, compound gains you may get, avoiding admission avoidance, all that kind of stuff. Are you using a particular classification system? Where are you going with that?
Q frailty. So, and we can map where those patients sit, like across different regions. So you can look at that from an ICB strategic point of view. You can look at that from a PCN point of view. Understand where your risk sits, where your volume of work sits, and then deploy your workforce accordingly as well.
Awesome. And where can people find out more?
On our website, so primarycareit.co.uk.
Okay. And I guess in terms of
Vanessa.
Interruption there, but that's all well and good. So GP learners, plenty more content to come. This is just a quick message to say, if you're finding this content useful, definitely leave a comment down below and subscribe at the same time so you can get in contact for the next episode that was a part of my best practice journey, where I went around and talked about the digital front door with quite a few different providers that we've heard from, as well as their tidbits and tips of how to attend conferences. This is cool content. You won't want to miss it, so make sure you subscribe to get that, and let's get back to hearing from those providers. So here at Best Practice Day 2, tell me about what you guys have got coming from FDB.
Hi, well, it's a pleasure to be here at Best Practice again this year. Fantastic turnout, really excited every time we attend. So yeah, we're really excited to announce that we've got AccurxUK now available in TPP. This is our clinical decision support solution that's really targeting the population health stratification for practices, PCNs and ICBs. We're really looking forward to having opportunities to work with clients in the NHS.
So for practices that now have access to that, what does that mean that they will be able to do from tomorrow if they start using it?
So basically, those who might be familiar with our other solution, OptimizeRx, AccurxUK offers a far more proactive solution in terms of automatically finding patients that need some form of monitoring, clinical intervention, linked to national best practice in clinical coding, all the amazing stuff we do within Optimize as a solution in primary care at the moment. Really easy to activate, easy to turn on, providing guidance, support at the point of care, but also really reducing the admin that teams have to input in, finding those patients in the first place and actually actioning them within the point of care. The beauty with AccurxUK is it's part of the clinical solution. So there's a lot of organisations that they're using disparate solutions, extracting data from one, putting it in another, or having to leave the clinical system to use another piece of software. With AccurxUK, it's all within the clinical system. So finds a lot more time for those clinicians.
So built-in, slick, easy to use.
Absolutely, smarter, quicker, more intuitive, absolutely.
So day 2 best practice here with Daniel from intouchnow. Tell us about what you guys have been up to this year at best practice.
So we're an AI voice company, and so been working with lots of new practices this year around integrations with EPR systems, secondary care with Cerner and whatnot. Big change for us over the last year is we're now a Class 1 medical device registered with the MHRA, and so safe to have the AI guide patients through care pathways, signpost to pharmacy first, and all the fun things that come with it.
And what's the biggest lesson you've learned with that classification and that journey to get to there?
Yeah, technology is the technology, which is great and people love it. The important bit is the information governance clinical safety case. And so that actually when practices deploying it, they're doing so safely and that they understand the transferred risk and all the elements that come with the product.
And the practices that are signing up with you, what's your biggest message to them as to how to make sure that they can stay safe but also be effective with their patient populations?
Definitely. Be open to completing a DCB 160 by standard, not as a negotiable.
Okay, cool. So here at Best Practice Day 2, here with Carmelo from Rapid Health. How's it been going?
Good. Always nice to see our customers, new customers, see what else is going on in general practice. So yeah, great 2 days.
Awesome. So what's new with Rapid Health?
out of the way, please.
Okay.
So what we're doing is, this month in October, we are launching in the NHS app. So we're excited about that. Hopefully you're going to see a lot of information in the media. What's happening there is, for the first time, the NHS app is going to be able to allow patients to practice who use Rapid Health to book an appointment whenever they want. They're going to be triaged, assessed, and booked into an appointment, all in the palm of their hands. Excited to be doing this with the NHS app team. Also going to be, there's some few surprises in there. We're one of the suppliers to be using some of their new capabilities. So we're looking forward to launching that in the next couple of weeks with select practices.
Definitely big stuff. I know in terms of many platforms trying to navigate, getting onto the NHS app has been a journey and a half over the past few years. So that's great news to hear. What's coming next?
For us, go to our website. So we recently launched a white paper to align to the NHS 10-year plan. If you go to our website and launch our white paper called Heal, it talks a lot more about what Rapid Health is doing outside of general practice, specifically in integrating care, urgent care, but also now moving into secondary care. So we're really excited in how the results we've seen in primary care, how we're going to bring those into the rest of the NHS system.
Day 2 best practice here with Fleming from LineIn, talking about what's new with them. What is new?
Well, this has been an amazing 2 days. In many ways, one, we've got so much traction, we had so much traffic here, we can just see that we're going to be really busy, expanding over the next period of time. And we have found some really, really cool collaborators, because we understand now that we need to evolve LineIn. So moving away from just having a human answering telephones and helping practice and with the demand, we need to integrate some AI into that and have like a dual pathways into the practices, offering patient choice. And I think that's the most important aspect of what we need to develop over the next 6 months to a year.
And how do you think that will change the patient journey?
The journey is that sometimes there's a call queue, and if we can then offer that option that they don't have to wait in the queue, they can then just make a little left turn, talk to an AI, resolve simple issues. Let's say it's not working, well then they jump back into the queue and they talk to the human, so that means one attempt and they get a solution. And I think that's the main thing.
Awesome. Hey GPLers, so I'm here with Lorenz from MedLink, and we're talking about what you guys have been up to. How's you finding the conference?
Yeah, it's good. It's good. It's got a good vibe. We've got lots of people that are, it starts slow but then builds up. So no, I think we're happy.
Cool. And what's new with MedLink this year?
Well, we are integrated with EMIS, and that's allowed us to now automate how we analyze record for patients. We also invite patients for practices, and we do all the coding for them, whereas previously it used to be quite a manual process. Now everything just runs out of the box and automatically. So we're even more automated.
So it basically just runs in the background. You don't have to do anything as a practice, making life hopefully easier, simpler, and possibly even a bit more cost effective?
Yeah, absolutely. So I think the big changes is we help with the administrative task of running searches, etc. We do that automatically. We invite patients by NHS app, email, SMS, and voice calls. So there's a huge reception burden that we're taking away. And we do all the coding automatically as well. And then the biggest saving that we started off with is the clinical time that you save by clinicians, essentially triaging which patients they want to bring in and which ones they don't need to, and therefore releasing time to do other work.
So I'm here at the Redmore Health stand and back at Best Practice Day 2. How's it going?
It's going really well, yeah. We've had lots of interest from lots of people, especially about our communication service and our new AI avatar service.
So tell me about this AI avatar thing.
Okay, so it's a really simple way to communicate with lots and lots of people online. One of your familiar faces from a practice, so it could be a GP, it could be a nurse or a receptionist. They record something for about a minute and a half. And from that, we can use our AI magic and turn that into any message that you want to communicate out to any patients. We can also convert them messages into 140 different languages, so we can reach more people.
Wow, that's amazing. And when you say they can access this, is that through the website? Is that through an app or something else?
So we give the practices a link. They can either put it on their website, they can put it on social media, or they can attach it to a text message to a patient. So if you're inviting them to a diabetes clinic, you can add some information about what's expected to happen in that clinic on one of these videos in that link.
Awesome. Day 2 best practice, here with Matt from Welby. Tell us about yourselves.
So yeah, we're WelbyInnovate. This is our first time coming to a big conference like this. But yeah, we've got to about 100 practices, serving 1 million patients or so, just within System 1. So we've been telling a few best practices to jog on in the nicest possible way. But yeah, helping practices with their recall, how they manage their results, how they manage their prescribing safely.
Cool. So specifically, what does Welby do for practices that other tools don't do?
So our recall system combines everything together, all your annual reviews, all your med monitoring, all your one-off things that you might want to monitor, and it pulls an integrated system for invites and prompts for staff. We can manage over half of all your blood results and file them, not just filing the satisfactories, but the abnormals, and sort of bulk message patients about things like over-the-counter vitamin D, offering statin dose increases, coding diagnoses. So we find that it's a really kind of different way of working, and we've not come across anyone doing anything quite like it. GPs love it, particularly if they can leave an hour a day earlier because of all the impacts of our systems. So yeah, someone who's been married to a GP for many years, that's very satisfying to see.
So, best practice day 2, here with the team from OneAdvanced. Why don't you guys tell us what's happening new and what's new with OneAdvanced at the moment?
Brilliant, yeah, so there's a lot of new, a lot of old, so we've been around for the last 30 years. A lot of technology is changing, a lot of people are now coming to the market with new technology, however, nobody really knows what AI is really bringing. So this is something we're really investing in. We're trying to create a platform, we are creating a platform which all of our tech is going to sit on, and now we are trying to evolve our historical products, legacy products that have been there for such a long time, whether it's Adastra or Dotman in primary care. So the primary care, we've created 2 agents, which we're going to be creating more agents for the Dotman solution, which is going to sit on top of the Dotman product to enable you to be able to use the Dotman system a lot easier and a lot simpler, which will aid the human, which Vishal will go into a little bit more in detail.
All right, so tell us about it, Vishal.
Thanks so much. So I think one of the main questions that we had when we were thinking about these AI agents was that how do we use what the practice is already used today and make it a bit more efficient? So we've come up with 2 new solutions, 2 new AI agents that we call them, the AI coding and the AI summarization modules. Essentially, the work that we're trying to do is to reduce the admin time that's involved in the whole document management process. What we're telling practices is that 2025, when systems are smart enough to do a lot of the work for them, just use it to your best potential. Use the system so that it does the work for you. That's what our focus is as of now.
So we're here, day 2 best practice, here with Raghav from Heidi, and I believe you guys have gone through a little bit of a change, haven't you?
That's correct, yeah. So today's one of the first conferences where we've unveiled our new rebrand. So you can see some of the different colors here. The products changed slightly as well. So yeah, brand new colors, brand new logo. Drop the health, so it's just Heidi. So yeah, it's a super exciting time for us. It's been 6, 7, 8 months in the making. So super exciting to have it unveiled at the conference today.
So quick little bit of nerdy geekiness then. If you've ever watched the Facebook film, one of the things that they did is they dropped the from the Facebook to make it the Facebook, and then suddenly they became like the biggest social media platform in the world. So who knows? You never know.
I think that's causation.
There we go. So what's happening new in Heidi apart from obviously the rebrand itself?
Yeah, so we've got a couple of really exciting things that will be coming shortly, and we've teased them a little bit today. First is calls. So we've had that in kind of a beta stage, and you can see a little bit of an explanation on our slide, on our stand there. But that's, I don't want to say too much before actually having it unveiled in the wild, but that will be a very, very new kind of offering on our Heidi platform, which is kind of very related to our rebrand of taking us from an AI scribe to an AI care partner. So I'll just say stay tuned for that. I'll also say stay tuned for Heidi being more integrated into a GP's technology stack. So those are a couple of things.
I know that's one of the things I always get asked about, the integration level of Heidi and where it's at. So keen to hear how that progresses over the near future. So day 2, best practice, almost coming to a close, but I'm here with Ben from Clinic. What's new with you guys?
What's new with us? Well, we've had a great show. We've been exhibiting our soon to come to market NHS app. and also our self-booking appointment, which is integrated into our solution, so patients can now automatically book into slots, which can be configured by practice. So it's not an open access to all patients. Practices configure which slots they want patients to automatically book into.
Awesome. So at the point of then contacting the practice, they can go straight through to the appointment through a booking link that's then provided directly by the practice integrated to the tool?
Exactly that. Or at the front end of our patient form, they can also book into common slots like flu vaccinations or cervical smears or things like that.
Awesome news. So GP learners, day 2 of best practice here with Umar from Abtrace. How's it going?
Really good. Yeah, really good as always. Best practice is always one of the biggest events of the year. All of primary care seems to be here. Well, most of primary care seems to be here.
Most of primary care, yeah. I guess for those that aren't at best practice then, what would you say is the key thing that they can expect from Abtrace coming up now?
I mean, we're shipping so many things. It takes quite a while to get through a demo these days, but one of the main things that we've done recently is the patient engagement portal. So the idea is that rather than sending people messages over and over again and having multiple contacts, that's inefficient for the practice, but it can also be quite frustrating for the patient. So every time we contact the patient, let's tell them everything they need, all of their questionnaires, all the appointments they need, all of their schedule for what the next year looks like for them, so that they can feel empowered and they can feel that they can get a lot more done. And we kind of respect the time of the patient as well. And obviously that leads to engagement, that leads to better monitoring, that leads to more efficient practice as well.
Absolutely. I can see how that will then streamline things, so less visit to the practice, less pressure on the team, and actually better engagement with the patients, like you say.
It's a genuine win-win, and there's not many of those.
Yeah, absolutely. And I guess in terms of what's coming up next then from Abtrace, from your point of view?
There's a lot that I can talk about, and there's a little bit that I can't talk about. But essentially, we started with automating the chronic disease and long-term medication pathway. And over time, we're taking away more and more off the hands of practice and handing it over to us. So whether that's making sure the right patients come in, making sure they get all their bloods done, maybe avoiding the appointment altogether, and now going a little bit further. Can we maybe help you request the test? Can we help you deal with some of the implications of that monitoring and take the next step and move on to the next level of therapy? So all of that is coming in. There's lots more building. Our team has increased, and so that means the products that we're building have increased. And because of that, our customer footprint has increased. So it sort of feeds into one.
Hey, Best Practice. So I'm here with the queen of Best Practice, Tara from THC. How are we doing?
I'm really good, really good.
Yeah, and how's today been for you?
It's been brilliant. It's been day 2's today. It's been really busy. It's just, I've seen a lot of current clients, former clients, friends. I have enjoyed this year the most. Really liked it.
Definitely, and particularly after your stellar day yesterday. Now, let me give you a story about this, EGP learners. So I tried to go to Tara's session yesterday. Not only was the queue coming out onto the forecourt, but additionally, when I got in, Tara was like, Gandhi, you don't need to see this, leave so more people can actually come in. So it was an absolutely amazing session. Tell us about Networks to Neighbourhoods.
It's called From Networks to Neighbourhoods, The Uncomfortable Truths About Collaboration. And I think the message from the talk is for the networks that are struggling to work collaboratively, if they continue to do the same things, you can't be surprised if you get the same outcomes. Like if you struggle now, you are definitely going to struggle in your neighbourhood. So we talked about money mindset, and nothing is wrong. It's just different, and it's being okay with people's differences. We talked about the kind of stories and the characters we place. We've got the villains, the heroes, the victims. I did talk about clinical leadership and maybe said something a little bit controversial, but I've supported over 300 primary care networks, and sometimes there is a lack of clinical leadership. You've got clinical directors that don't want to be clinical directors, but they're in that position if they want to do the best job that they can do, but their heart's not in it, and it's a very difficult job to do when your heart's not in it. So I felt it was tough love.
Sounds awesome. And I guess if you did want to know more about Networks Neighbourhoods, another place you might catch that is our PCM Plus conference in April, isn't it?
Yes, I'm really excited. Nottingham, 22nd of April. It's going to be brilliant.
Yeah, and obviously you get myself and Tara and Andy and Ben. Yeah, so we're going to have an amazing conference in a brand spanking new venue as well. Yeah. Tara knows how excited I am. When I saw this place, I was like, we are doing it here. So absolutely make sure you join us. Probably have links to all that in a short time. And that was all the different providers I spoke to at the conference. If you want to find out more about that aspect of the digital front door, managing the flow of patients through your practices that some of those providers talked about, then definitely check out this episode right here that covers that. Alternatively, if you want to see the episode where I found out from them about their tips on going to a conference and what you might want to do in preparation for next year when we're hopefully going to be there doing something extra special, then definitely check out this episode here.